Hello, and welcome to Adventures in Neuropathology with your favorite neuropathologist, Andrea Gilbert. Today's video is going to be the very first in a series of videos that are meant to help people who are studying for boards. So folks who are residents in pathology, neurology, neurosurgery, anybody who might be taking a test that involves neuropathology, these are the videos for you. So today's video is going to be the first installment of several videos that are meant to help with studying for boards and thinking about how to approach problems in neuropathology. So this video series is going to be focusing on tumors that arise in the context of familial tumor syndromes. So without any further ado, let's get started. So this is going to be kind of a review that is organized as a mystery case. Okay, so our first mystery case number 1, and here is our question. Okay, so the question is, what is the most likely diagnosis? So what are we seeing here? Okay, so we've got a piece of dura here overlying this brain, and notice how this lesion is very well circumscribed. It's got kind of a fleshy look to it, and notice how it's indenting into the cortex of the brain, and the brain has not been invaded by the tumor, it's just indentation by the tumor, and so this is a meningioma. So in the context of familial tumor syndromes, if a patient has a hereditary tumor syndrome and they have a meningioma, what are some common hereditary tumor syndromes that are associated with meningiomas? And so meningiomas are very common. They are the most common benign primary brain tumors, or CNS tumors, not really a brain tumor. But the most common overall primary CNS tumor and most common benign brain tumor. So the vast majority of meningiomas are sporadic, but in the context of familial tumor syndromes, when we see them, we can see them in a variety of different syndromes. So here we have a table where we list a variety of different syndromes where meningiomas can be a feature of this syndrome. And so what I have here is the list of syndromes. I've blocked these out, and on this column of the table we're seeing the mutated gene that's involved and the involved pathway that's involved. So for the list of syndromes that the familial tumor syndrome that is associated with the listed gene, I was wondering if you guys can help me fill this in. So the first one, we've got the easiest one. The first one is NF2. And so this is our first one. The neurofibromatosis type 2 is going to be associated with mutation of the NF2 gene, which encodes a tumor suppressor that's involved in this pathway. Okay, so that was our easiest one. Okay, so what's next? Okay, so the mutated gene is WRN. Which familial tumor syndrome is this associated with? Now this is kind of a hard one, it's unusual. This is Werner syndrome. Werner syndrome is one of the adult progeria syndromes. This is an old age where you're looking at a child, but they look like they're 80. And patients with Werner syndrome, they can get meningiomas. The next one is BAP1, tumor predisposition syndrome, and this is associated with a mutation in BAP1. BAP1 mutations are very characteristically found in rhabdoid meningiomas, and so this is a common thread throughout medicine, right? We have these germline mutations within these folks who have these syndromes, and that really helps us to understand when we find these mutations in somatic mutations arising within a spontaneous sort of situation, and being able to infer what that means by these folks who have these germline mutations. So BAP1 tumor tumor predisposition syndrome. These patients, they tend to get rhabdoid meningiomas, which, as you remember, is a grade 3 meningioma. It's pretty bad. The other histologically classified grade 3 meningioma, do you guys remember what that is? So we have some meningiomas that are histologically, if they have this histologic subtype, it is 100% a grade 3. And the two major meningiomas that are that have these histologic subtypes that are automatically a grade 3 include rhabdoid meningioma and papillary meningioma. The histologic subtypes that are automatically a grade 2 are clear cell meningioma and chordoid meningioma. So you guys can remember that as CPR. C coming earlier in the alphabet and PR coming later in the alphabet. So C is clear cell and chordoid. Those are grade 2 meningiomas just by their histologic classification, automatically a grade 2. And then rhabdoid and papillary, those are grade 3 meningiomas. Rhabdoid meningioma is bad news, and they often have this BAP1 mutation. So that's bad news. The SMARC-E1, these are very characteristically found in clear cell meningiomas. And remember just what we talked about, clear cell meningiomas is a histologic subtype where automatically it gets a grade 2 just by having the clear cell subtype. So SMARC-E1 and SMARC-B1, they are associated with these germline syndromes, so that there's no special name for them. There is a syndrome that's associated with a patch1 gene and the patch1 mutation in the sonic hedgehog pathway. These meningiomas who have this patch1 gene somatically, that's not that common. There is a familial tumor syndrome that characteristically has alterations in patch1 and sometimes less commonly in SMO or SUFU. This is Gorlin syndrome. Okay, Gorlin syndrome is also known as nevoid or basal cell carcinoma syndrome. These patients, they get a lot of basal cell carcinomas, they get a lot of meningiomas, they also have some other characteristic features such as odontogenic keratinomas and things like that. Okay, and then our last one is syndrome that is associated with P10 gene. P10 gene syndrome. So this is Cowden syndrome. The way that I remember that is P10 Cowden, kind of rhymes. Or you can think of pinning up 10 cows. Okay, so you know, little mnemonics to help you remember. But Cowden syndrome, these folks, they can get a lot of different tumors, and meningioma is one of many. Okay, so that was a good warm-up case. Okay, good job, you guys. All right, so let's move on to our next case. Okay, so that was a whirlwind tour of meningiomas arising in the context of a familial tumor syndrome. If you like this video and you think you might have learned something, please subscribe. You can find us on Facebook, YouTube, Twitter, and Instagram. You can also check out our website at Adventures in Neuropathology. If you guys find this video to be of interest, please feel free to check out my new book. This was written with Dr. Daniel Mais. I wrote the Neuropathology section for that. And it's a great book, a bullet point interest of various topics in surgical pathology. So, all right, see you in our next adventure.